If you have a child who is going through vaccinations, it's very important that you understand how to activate the lymphatic system between vaccinations. When children start vaccinations, they can have a little inflammation every time they get these vaccinations, and that's typically once a month. And when we do vaccinations once a month and we're creating inflammation in our children, we can affect how they feel and think. Because every time we do a vaccination, that inflammation process makes cellular waste in the body. And if the lymphatic system is not working optimally, then that cellular waste can build in the skin, the digestive tract, in the brain, really anywhere in the body. And this can affect children with how they sleep. You'll see children won't sleep as well. You'll see children being very cranky. They may have constant colds all the time, a runny nose. They may get a fever during the vaccinations. But what I'd like to teach parents is that you really have to take control, and between vaccinations, about midway, if you're doing it once a month, about midway, you want to put your child through a very gentle detoxification, a lymphatic system detoxification. And you do this by putting them into an Epsom salt bath. If it's an infant, you can use a little infant tub, and you'll use maybe a quarter of a cup of Epsom salt. And if it's in a bathtub, you can bring your child into the bathtub with you if it's a young child, or if they're old enough to sit in the bath themselves. You put 2 cups of Epsom salt into a bath, 2 to 3 cups depending on the size, and they sit in there for anywhere from 15 to 20 minutes to a half hour. And what it does, when you put them into an Epsom salt bath, you're putting them into magnesium and sulfates. And magnesium, typically we take it through our mouth, and it has to go through your digestion and get broken down and then get into your bloodstream. When we put our child or put ourselves into an Epsom salt bath, we're sitting in magnesium bath, and it's absorbing through our skin, which is a whole different way than through our digestion. It's actually going into the veins, into the lymph system, and being pulled into the blood. So it's an easy way to get magnesium into your child. Now sulfate, it's called magnesium sulfate Epsom salt. The sulfates make nitric oxide. And nitric oxide helps oxygenation, it helps open up the blood vessels. There's a lot of research on the benefits of nitric oxide. So just by putting your child through a bath a few times, I would do it 1 week, maybe a week after the vaccination, do 1 bath, and the next week I would do 2 baths a few days apart, and then I would do 1 more bath. And that way you are moving their circulation, you're helping to move waste out, and you're also relaxing them. Again, when we're putting them through this much inflammation each month, it can actually affect how they feel mentally, and they can be very aggressive or have ADHD. And again, a lot of things that play into this, but vaccinations may play a role by making your child more inflamed. Also, make sure your child is hydrated. You know, often we give child a glass of water or a bottle, and they'll drink a little bit and then it sits. So we really want to monitor how much water they're drinking, because if they're dehydrated, then the lymphatic system isn't working as well. So basically, you can even massage them a little bit. Just take their arms and just do a little gentle squeeze, like it's a little dough, like a pizza dough, and you're just squeezing down the arm. It should never hurt. Then do the other arm. You can squeeze the legs very gently, and these things make a difference. Of course, you can always bring your child for a professional massage or a lymphatic drainage if you really want to maintain their lymphatic system, so that they go through their vaccinations much easier without complications. So I hope you understand how vaccinations, and because they create inflammation every month, and you do this for almost 2 years or more, we're again creating toxicity in our children. And I've talked to many parents of children who have autism, and they said that around 15 months their child was doing very well, and then they started to regress. Whether this is due to vaccinations or the food we eat or the environment, who knows, but it really is about getting your child to be less toxic. And again, if they're getting vaccinations, you want to clean them up between by at least giving them a couple of Epsom salt baths, making sure they're having more water, maybe some digestive enzyme if they're able to take a pill. If you have any questions on how you need to maintain your child between vaccinations so that they can think and have healthy skin and digestion, contact me at osipinskihealthacademy.com.